I want to begin with an interchange you had with Senator Marshall about long COVID. When you and I met in my office prior to the hearing around your confirmation, I talked to you about my own long COVID experience that has been consistent for now 6 years. Thank goodness it's mild and annoying rather than debilitating, but I have Senate colleagues who have also dealt with their own long COVID issues, and also Senate colleagues' family members have. This is a big issue. I was happy to hear that Secretary Kennedy convened roundtables that included Senator Marshall and Senator Young in September, but I also want to put on the record a number of steps that the administration has taken that make people who are dealing with long COVID wonder if the administration really cares about them. Last February, the Trump administration pulled down key information on public websites that provided guidance to Americans with long COVID on their rights under the Americans with Disabilities Act. That information was removed. The president issued an executive order to terminate the Department of HHS's advisory committee on long COVID. And then last March, the administration shuttered the Agency for Healthcare Research and Quality's Long COVID Coordinating Center, which is used to coordinate long COVID centers funded by HRQ. That was bipartisan funding that Senator Young and I worked to secure. All that happened before the CDC downgraded its recommendation of the COVID-19 vaccine, and the research shows that being vaccinated is one of the best and most accessible ways to prevent long COVID. So the roundtables in September are good, but there have been a whole series of administrative actions that have made folks dealing with long COVID wonder if this administration cares. I want to ask you about other topics, but I would like to ask you or your team to come in and spend some time with my team to talk about what the NIH is doing in this area so that I can hopefully communicate to people in Virginia and elsewhere that this is a priority that's being taken seriously. Can I get your commitment to
Absolutely, yes, Senator. Happy to, because the NIH is committed to finding an answer for long COVID patients.
And I appreciate your point that it's not just about finding the biomarker. If you can, even if that's confusing, if you can find treatments that are working, that's a really good thing. And so I look forward to talking to you about that. You preside over an agency that has shrunk dramatically. Before you were confirmed at the end of 2024, NIH employed more than 21,000 people. Entering this year, the workforce has been reduced to 17,300, and of those nearly 4,000 departures, 1,100 were doctoral level scientists. In preparation for this hearing, I reached out to Virginia grantees, and here's what I hear about their interactions with NIH. First, significant delays in peer review and award cycles. In 2025, NIH canceled scores of peer review meetings, delaying evaluations of thousands of applications for about $1.5 billion in funding, a backlog that you're still resolving. Much of this happened before the government shutdown that began in October. That made it worse, but it was already a serious problem. Second, I hear from grantees increased burdens about the funding drawdown process as they're trying to get funds drawn down on grants they've received. There are additional requirements that have been added to requirements that are already pretty burdensome. Third, backlogs and reduced award rates. NIH fell behind in awarding grants in 2025. Again, this started well before the October 1 shutdown. Fourth, disruptions to research programs and personnel. I think Senator Hassan asked you about that. Fifth, increased communications challenges. Grantees report communication with NIH has ground to a halt in many ways, and that NIH staff appear to be overstretched, carrying increased responsibilities. And finally, rapid policy changes without sufficient community input. Policies need to change, but there ought to be a dialogue about that. This is what grantees are telling me about their interaction with NIH now. And I look at those concerns, and I look at the shrinking of the workforce, and I believe that they have to be connected in some way. What are you doing to address these backlogs and challenges that the Virginia grantees and others are expressing?
Just don't have a ton of time, but let me I'll focus on the backlog. I am tremendously proud of the NIH employees because we got all of those grants reviewed by the end of the fiscal year. But that's why we were able to get the money out. Tens of thousands of reviewers devoted their time. I used to be one of those reviewers myself. Even after the Senate, after the shutdown in October, I was really worried about that. Since the reopening of the NIH after the shutdown, people have just stepped up at the NIH and all across the country to review the grants, and we're basically not going to have any delay as a consequence of the shutdown. I mean, it's people have really stepped up, Senator, and we're working on filling personnel holes and all that. I mean, I personally don't want to see any delays because I was a researcher myself once. So it's something that we've worked on heavily and achieved a lot of success. I think there were disruptions last year, but I'm hoping this year that even with the shutdown and all that, we've figured out processes to be more efficient, reduce the amount of administrative burden and red tape, so to make researchers' lives easier to propose amazing ideas that'll improve health.
I'll keep giving you feedback on what my grantees are expressing as we're into 2026.